So the first thing I would do is I would pick up the trach catheter, and I would attach the trach catheter with my non-dominant hand to the trach tubing. So that would be not sterile anymore. Next thing I do is turn on the suctioning to 100 to 150 milliliters per milliliters of mercury. And then I would turn on the ambu bag to 100% oxygenation. The next thing I'm going to do is put the tip of the catheter into sterile saline to lubricate it, and then I would suction to check that the catheter is working, and it is working. The next thing I would do is remove the trach plate, and then I would put on the oxygen, and I would give 5 to 6 breaths over 30 seconds, and then I would remove the oxygen, and I would slowly put in the catheter without touching the outside, and I would do that until the patient coughed or I hit resistance, and then I would pull back 1/2 inch, intermediately suctioning while rotating the catheter, and then I would pull it out and dip it into saline again. I would then put the oxygen back on while giving 5 to 6 breaths for 30 seconds and wait a full minute before suctioning again. During this procedure, I would check vitals to make sure if the heartbeat or heart rate went 20 beats higher or 20 beats lower, and or if the oxygen went below 90% or 5% below the baseline. And if that were to happen, I would stop suctioning. So after the full minute is over, I would place the trach catheter back into the trachea, and I would go until I hit resistance or the patient coughed, and I'd pull back 1/2 inch, intermediately suctioning while rotating the catheter, and then I would dip it back into the sterile saline. At this point, I would put the oxygen back on and give 5 to 6 breaths for 30 seconds, and then wait a full minute before suctioning again. Throughout the procedure, after suctioning, I would ask the patient if they could cough and to clear any secretions. And then after the full minute, I'd place the catheter back in until I hit resistance or the patient coughed, and then I'd pull out 1/2 inch and rotate, intermediately suctioning, pull it out, dip it into sterile saline, and then I would give oxygen 5 to 6 breaths for 30 seconds, and then I would take the oxygen off, put the trach plate back on, and then I would be done with the procedure. And then I would remove my gloves, glove to glove, and then skin to skin. And I would dispose of those.